Welcome. Today we are covering a high-yield topic for your university exams, the rationale behind investigations before starting lithium therapy. Before initiating lithium, a comprehensive medical workup is absolutely essential because it has a narrow therapeutic index and affects multiple organ systems. Let us break down the 8 key areas. First and most critical are the renal function tests. Lithium is 95% excreted unchanged by the kidneys. You must get a baseline serum creatinine and estimated GFR. Impaired renal function significantly increases the risk of lithium toxicity, and a baseline helps you prevent creatinine creep and monitor for chronic kidney disease. You also need a urinalysis, specifically checking specific gravity, to assess the kidney's concentrating ability. This is because lithium can cause nephrogenic diabetes insipidus, leading to polyuria and polydipsia. Second, endocrine tests. You must check baseline thyroid function, including TSH, T3, and T4. Lithium inhibits the release of thyroid hormones, carrying a 7 to 10% risk of hypothyroidism, which is 5 to 9 times more common in women. Remember, untreated hypothyroidism can easily mimic or worsen depressive symptoms. Third is the cardiac evaluation. An electrocardiogram is recommended for patients over age 40 or those with existing cardiac risk factors. Lithium can cause T-wave flattening or inversion, sinus node dysfunction, and bradycardia. Crucially, it may also unmask Brugada syndrome, which is a potentially life-threatening condition. Fourth, we check serum electrolytes, specifically sodium and calcium. Lithium is handled by the body very similarly to sodium. If a patient develops hyponatremia, it leads to increased lithium reabsorption in the renal tubules, which can rapidly precipitate toxicity. For calcium, lithium can cause hyperparathyroidism and hypercalcemia by shifting the set point for the inhibition of parathyroid hormone secretion, potentially leading to behavioral changes or renal stones. Fifth, hematological tests. A complete blood count is needed specifically to check the white blood cell count. Lithium characteristically causes benign leukocytosis, meaning an increased neutrophil count. You need this baseline so that a high white blood cell count later on is not misidentified as an infection or a leukemia. Sixth is reproductive history. A urine pregnancy test is mandatory for females of childbearing age. Lithium is a known teratogen, classified as pregnancy category D. First trimester exposure is famously associated with an increased risk of Ebstein's anomaly, which is the downward displacement of the tricuspid valve. Seventh, you must record anthropometric measures, namely BMI and weight. Weight gain is a very common side effect experienced by about 30% of patients. Establishing a baseline is necessary for monitoring metabolic changes and potential obesity-related complications down the line. Finally, other recommended investigations include fasting blood sugar and a lipid profile to screen for metabolic syndrome, which is common in bipolar patients and exacerbated by weight-gaining medications. A basic dermatological assessment is also wise to note any pre-existing acne or psoriasis, as lithium is notorious for exacerbating these skin conditions. In conclusion, a thorough baseline workup ensures patient safety, allows for the objective monitoring of side effects, and helps you differentiate lithium-induced changes from primary medical illnesses.